to Info Corona. Now, the deadly coronavirus has been wreaking havoc across the world for months now. It's forced large and small countries into a total lockdown. It's already claimed over 3 lakh lives across the globe, infected more than 4.7 million people. The question now, as countries have gone into lockdown mode, is a big one. When do you exit a lockdown? How do you ease restrictions? India too has slowly decided in lockdown 4.0 to start lifting some of the restrictions. Let's take a look then in Info Corona at exit plans across the world. Take a look.
In India, the onus is now on individual states as to how they see the lockdown happening. And apart from the spread of infection, one of the primary concerns is how to get the economy going. A concern that is being reflected around the world in how countries adjust their responses to the pandemic. In the United States, the worst hit country by the pandemic, restrictions are being eased in a majority of the country's 50 states. Businesses have resumed, but with fewer employees and customers. Social distancing measures and guidelines are still in place.
We will revive our economy and we will transition into greatness.
In the UK, Prime Minister Boris Johnson has announced a slight loosening of England's lockdown, with people now allowed to meet with another person from a different household in a park. However, social distancing must be maintained under the rules and gatherings of large groups are not allowed. In Italy, the government started loosening restrictions from May 4th, allowing people to go back to their permanent places of residence and restarting construction, wholesale and manufacturing activities. While large public gatherings are still banned, church and other religious services resumed today, and museums and galleries have also begun to reopen. The country will also open its borders to travelers from Europe June onwards. The French government began easing restrictions on May 11th. While restaurants, bars and theatres remain closed across the country, at least until June, non-essential shops, factories and other businesses have been allowed to reopen. In Spain, some of the toughest restrictions in Madrid and Barcelona have been eased. Stores there can now receive customers without appointment, and museums can reopen with strictly limited capacity. The Spanish government has sought a final 4-week extension to its state of emergency. Germany, where the death toll from the virus has been lower than most of its European neighbours, most lockdown measures have already been relaxed, with gradual reopening of schools, shops, restaurants and even soccer. Meanwhile, despite tentative steps in many countries to begin restarting normal life, the World Health Organization's top emergencies expert has warned of a long battle still ahead.
If that virus transmission accelerates and you don't have the systems to detect it, it will be days or weeks before you know something's gone wrong. And by the time that happens, you're back into a situation where your only response is another lockdown. And I think this is what we all fear, is a vicious cycle of public health disaster followed by economic disaster, followed by public health disaster, followed by economic disaster.
In Asia, and particularly China, where the COVID-19 virus first appeared, social distancing and ban on foreigners entering the country is still in place. But the world's second largest economy is increasingly opening up to allow both large factories and small businesses to resume production and dealings with customers. South Korea, which recently saw a spurt in cases, re-shuttered some nightclubs and bars, as well as delayed the planned reopening of schools by a week. But the government has stood by its decision to ease border restrictions by reopening offices, public facilities and sports centres. Singapore too has allowed small businesses to resume operations even as the novel coronavirus cases continue to rise there. Japan's Prime Minister Shinzo Abe has announced the end of the state of emergency for most regions of the country, but restrictions are being kept in place in Tokyo and 7 other high-risk areas. In the COVID timeline, India is behind by a month compared to all the countries just mentioned. So what happens in these countries could be a possible scenario of how things might pan out in India in the weeks and months to come.
So when is the right time to exit? How does one deal with the lives versus livelihood debate? I'm joined today by a very special guest, Professor Devi Sridhar, is Professor and Chair of Global Public Health at the University of Edinburgh. Importantly, she called out the Boris Johnson government on herd immunity a few months ago and predicted a coronavirus outbreak 2 years ago. Appreciate your joining us, Professor Sridhar here. Give us your sense of the big picture as it is now in the middle of May. Is the worst over, or do you see a second wave of coronavirus soon across large parts of the world?
I think we're just at the start of this outbreak, and unfortunately, the worst is probably ahead of us. Early serological studies that look at how many people have already been exposed to the virus seem to place it at less than 15%. Which means we still have a long way to go to actually control this outbreak or to find a vaccine or some kind of solution.
You know, Professor Sridhar, the thrust across Europe and even the US seems to be at the moment, find ways to ease the lockdown so you can get economic activity started. This even while the spread seems not fully under control, the desperation to revive economies seems to be taking precedence. Do you think that's a wise strategy?
I think it's quite dangerous to start easing restrictions when you still don't have full control of the virus or even surveillance in place to know who has it or which areas of the country are most badly affected. I think the risk is that you try to prioritize economic concerns, you ease restrictions, case numbers start to rise. At a certain point, they rise to a point where it looks like healthcare capacity is strained, and so you have to lock down again. And actually, even for the economy, it's much worse to be in cycles of lockdown and release rather than to ease very slowly while building up public health infrastructure. So it's a one-way road.
That's very interestingly put, these cycles of release and then another lockdown. The UK, Professor Sridhar, also seems to be sending mixed messages, urging people to work from home, maintaining social distance, but at the same time attempting to find ways to lift the lockdown and start the economy. Is that problematic when governments are caught between lives and livelihoods?
Yeah, it's incredibly important during an outbreak, especially one like this one, which is affecting everyone's lives, to have mixed messaging. I think the UK government has been quite confusing in what it's saying to the public, which is, you know, stay alert, stay home, but don't stay home, go out to exercise, but don't see other people. You can have one other person in your house, but make sure you only see one of your parents, not both your parents. It basically means that people have to interpret it the way they want to interpret it, and probably will lead to, you know, not a lot of trust in what is to come from this government. And so I think the communications is absolutely essential. And right now it's very confusing.
But how does, Professor Sridhar, one really resolve this dilemma between lives and livelihoods? Because the longer a lockdown continues, more people are hurting, jobs are being lost, the economy is at a standstill globally.
Definitely, and I agree with that. I think actually lockdowns are the worst position, in a sense, to be in. It's a blunt policy instrument that should be a last resort. We've now been in this lockdown for 8 weeks in the UK, in a lot of countries for many weeks. And the question is, what has been done during the lockdown to mean that when you exit it, you don't need to go back into it? And so building up public health infrastructure. What we've learned from East Asian countries like South Korea, Taiwan, Hong Kong, but also countries like Australia and New Zealand, is that if you're able to get your testing capacity up to a sufficient level, if you're able to get contact tracing in place, then actually you can lift these restrictions, have a lot of your economic and social activity continuing, and you end up just quarantining those who are carrying the virus and not quarantining everyone. And so the time in lockdown has to be used to going towards those objectives. Otherwise, it's just wasted time.
It's interesting how you are putting it again. In India, on the other hand, Professor Sridhar, we went for a lockdown 7 weeks ago. And while there hasn't been an exponential growth, we certainly haven't seen a flattening of the curve yet either. About 5,000 cases are still being added now every day. So how does one relax a lockdown in a large country like India? Can a country like India now only focus on hotspots?
Yeah, I think the key things I would first say is actually to have a decentralized response, which is actually guided by what is happening in transmission within certain districts, within certain states, and that actually it's very hard at a national level, at a federal level, to create policy when actually you're probably having very different situations, depending if you're talking about Kerala or if you're talking about Bihar. And so I think the first thing would be you need to have really locally led decision making. The second thing is actually we're seeing that this virus seems to target hospitals. It likes to transmit within hospitals. It likes to transmit within households. And so actually we need to have much more guidance towards, those who are vulnerable to know actually how can we stop transmission in these kind of hotspots and ensure that actually we protect people, both if they're at home and living in multi-generational families, or if they're actually in care homes, or if they're in hospitals.
But what, to your mind, Professor Sridhar, explains the relatively fewer cases of COVID, a relatively lower mortality rate, not just in India, but across South Asia as compared to Europe or the US? Is that something that we can hold on to as we try to emerge out of a lockdown?
I think, the first thinking I have, and this is looking at, for example, looking quite deeply into a country like Vietnam or into Thailand, but also India, is that the imperative on containment was so high. It was clear from the start that you could not treat your way through this outbreak. You would just not have enough ventilators. You would not have enough intensive care beds. And so countries which recognized this quite early and put the imperative on containment, meaning keep that number of people having this virus as low as possible, have ended up in a better position. I think what happened in the United States and in Europe and in, United Kingdom is that there was a false sense of actually this could be like flu. We could let it run through the whole population and we could just manage those who were ill by building more hospitals, buying more ventilators, and recruiting more staff in to treat them. And what we're learning with this virus is it's more like other coronaviruses like MERS and SARS, and less like a flu. And I think this accounts for why we have such high mortality in Europe and in the States right now.
Is the real solution then, while the lockdown is on, push ahead with contact tracing, push ahead with aggressive testing and isolating? The question, of course, is in a 1.3 billion strong country like India, how does one conduct such large-scale testing over a sustained period of time?
Yeah, it's a really, really challenging situation, but unfortunately it seems like it's the most effective way to get through this. And that, again, has to be done at community level. What we've learned is you need local public health response teams that have sufficient testing capacity, that actually know the community, have the ability to actually contact people who've been exposed to the virus and provide some kind of isolation facility or support if people are isolating at home. And so, again, we just need to break this down to community by community, and all that higher levels of government can do, whether it's state level or federal level, is support that local community response to make sure they have the number of test kits they need and they have enough resources to be able to do this. But it cannot be done at a central level, whether it's in India or whether any other country in the world. It has to be done at a local level.
The question, of course, Professor Sridhar, is do you think that one size fits all? The lockdown mode seems to be such at the moment that there seems to be a playbook for it. But what may be ideal, let's say, for a smaller country like Britain may not work in India. Do you believe, therefore, every country needs to find its own way of managing the lockdown at the moment or managing an exit plan?
Definitely. I think one of the big mistakes that we've seen from this outbreak is the adoption of similar policies across countries, though every country is first in a different part of this outbreak, and secondly, having different economic and social issues to consider when actually adopting different policy interventions. We're seeing this right now with the opening of schools. Some, countries in Europe like Norway Austria, Denmark are starting to open schools. And so the argument could be made, well, all countries should open schools because they're doing it. Well, they're able to do it because they actually had an early lockdown. They have good surveillance in place. They have a very low number of cases and deaths, so they feel comfortable to open it. So they're opening schools in all contexts doesn't make sense just because they're doing it there. Same to say about lockdowns. If you look at a lockdown and you say more people are going to die from this lockdown because of starvation or not accessing necessary medical services than will die from COVID, that's a very different position to be in than a country which has a strong social welfare net. In the UK, we currently have a very generous furlough package for those who are not working. And so actually, while you are seeing poverty rates increasing, the government is trying to increase social welfare at the same time to mitigate those effects. And so it really has to be done country by country, both on the stage of the outbreak they're in, but also the particular characteristics of the country.
That's right. We've, particularly schools and colleges in India, we've decided that they will continue with the lockdown. So we've been very cautious when it comes to schools and colleges, unlike some of the countries you mentioned, Norway, Austria, of course, much, much smaller countries. You've been very critical, though, Dr. Sridhar, of the United Kingdom government, trying to push for herd immunity in the initial days. Are you saying that herd immunity is just not possible with COVID-19? Because epidemiologists one speak to seem to suggest that eventually we will have to acquire some element of herd immunity.
I think we could get to herd immunity in three different ways. The first is you get a vaccine, which is the way we typically talk about herd immunity, let's say to measles or to mumps or rubella, which is you vaccinate 80% of the population, and that protects the 20% who are unvaccinated. You lose very little, you basically lose no one through that track. The second way is we're having, thousands of trials taking place for a therapeutic. If one of those comes off and we have a therapy, that means that actually COVID becomes a mild illness if you have this antiviral or drug available, then yes, you could build up herd immunity because enough people could be exposed and treated and saved. The third way you can build up herd immunity is you have no vaccine, you have no drug, and so on the way, you're just going to have people dying because you have no way of saving them. And the people who are going to die are probably going to be elderly, and they're going to be in vulnerable groups, having comorbidities like hypertension or diabetes or asthma. And so I think to do herd immunity without a vaccine or a therapeutic is incredibly dangerous. And right now, the imperative is for countries to try to contain this outbreak while we wait for some kind of scientific discovery. And I do think we will get one. Science is generally delivered. Right now, it's just a question of time.
It's just a question of time. Of course, that's the challenge. How do you buy time? And if you buy time, you need a lockdown. Now, one of the buzzwords in India at the moment, Professor Sridhar, is that we have to learn to live with the virus. What do you make of that? When people say around you, we are hearing politicians, governments saying, policymakers saying, we've got to learn to live with the virus. What do you make of that concept of living with the virus?
Well, learning to live with the virus basically acknowledges that we cannot eliminate it. It's not going to be gone. Even if you do have some kind of elimination, New Zealand has attempted this, Hong Kong and Taiwan basically try to stem out the virus. What they mean by that is not getting rid of the virus completely. It's that whenever you see new cases emerging, you try to kind of stamp it out. It's like a fire that keeps igniting and you have to keep stamping it out. The problem once you have community transmission, this is the position of North America, Europe, and now loads of countries across the world, is you would have to take such harsh measures, such grueling measures to eradicate this virus that actually you might cause more damage and more harm trying to eradicate it than you are with trying to actually just drive the number of cases down and try to keep it at a low level till you have a scientific breakthrough. We've only been able to, eradicate one disease in humans for, all of our lifetimes, which is smallpox. And that was a long campaign and a very difficult campaign. Polio is the one that we've been trying to eradicate for a long time. And what we've seen that is actually very difficult, even if you have a vaccine. So even with a vaccine, eradication is difficult. So to attempt this completely to eradicate it in large countries without a vaccine is just seen as pretty much unrealistic right now. And so that's where we come to actually, how do we live with this virus in a way that means we have a way to prevent it through a vaccine, we have a way to treat it through a therapeutic, or do we just drive down cases through traditional public health measures and basically keep the numbers as low as possible and keep surveillance in place to make sure that we don't see a resurgence of cases?
Given what you're saying then, that, it is, the challenge is to manage the virus in a way. and not live with the virus, but manage the virus in a way. Is there an ideal moment, Dr. Sridhar, according to you, to lift a lockdown? And this is the dilemma in this country at the moment, because the fear will always be, presumably, that if you lift a lockdown, the number of cases will rise. You could have a second wave. We're already seeing it that wherever public transport, interstate transport in India is intensifying, suddenly you have a spurt in cases. Is that a risk that you run, a risk that you have to live with? Where is that ideal time? Is there an ideal moment to lift a lockdown?
So the World Health Organization has outlined 6 criteria for actually supporting countries in lifting their lockdowns. It also provides advice on how to reopen schools and some of the considerations. And so some of the things you need to have in place is the ability to actually have adequate testing capacity, to have border control in place, to watch importation of cases, to have very good surveillance in hotspots, hospitals, care homes, prisons, places we see where this virus likes to transmit. But I think if countries follow that guidance and think through each of these 6 criteria very carefully, they can then evaluate their own response and say, how can we ease restrictions? There's also emerging evidence that this virus does not transmit as well outdoors. It's possible that its half-life outside is minutes, whereas its half-life indoors is hours. If this becomes true, then actually you could provide different kinds of easing of measures, perhaps those which are outdoor employment, outdoor schooling, outdoor activities. And so I think this is also hopeful if we can learn more about how this virus reacts to UV, to sunlight, to temperature, and to humidity.
You know, there is the China question. You were among the first in the world in 2018 to warn of a possible spread from China to the world from an animal infection, as you called it at the time. And you referred to a certain health interconnectedness, that a virus could spread very rapidly, you had warned at that time. Has the rapid spread of corona from China to Europe and the United States surprised you? Or was this something you, in a sense, as you wrote in 2018, expected to happen?
So I think it was expected that we would have a new virus or bacteria spreading rapidly around the world. Most people thought it would be some kind of pandemic flu or drug-resistant bacteria or a new virus that would spill over from animals to humans. I think what's been unexpected and surprising has been to see actually the countries' responses and how certain countries seem to be quite complacent about responding. I think you had quite aggressive action in countries that had experience of infectious disease outbreaks and who understand the destruction they can bring. And I think you saw complacency in countries which just had never experienced anything like this in the past 50 or 60 years. And so I think I'm not surprised that we've had an outbreak. I am surprised it's killed so many people in so many countries, especially in very high-income countries.
What for you, though, Dr. Sridhar, is the biggest learning then from corona going forward? Because countries, as they live with the lockdown, I'm not saying live with the virus, live with the lockdown, what is the biggest learning from corona, given the spread of the virus at the moment across the world?
I think the biggest learning that we have is that we have to get out of this cycle of panic and neglect in terms of outbreak response. We tend to have outbreaks, whether it's Zika virus or Ebola or plague or cholera, and respond to it and then forget about it and think it's not going to happen again. We're all likely to see another outbreak in our lifetimes and possibly another pandemic. And so what can we be doing now to actually prepare for the next one? What actually plans can countries be putting in place to learn from this virus so the next time we have an outbreak, countries can move much faster and hopefully save more lives? And lessons from this are really around diagnostic capacity, having good planning at the local level, rapid plans to actually expand hospital capacities, and also fundamentally for countries to work together. In the end, it's less each country for itself and more we're all facing a similar challenge of this virus. And the debates that are taking place in India or the United Kingdom or America or Greece are all very similar debates. What we're seeing is every country is having a similar debate and similar challenges. So how can we work together against these kind of emerging threats rather than work against each other?
Let me ask you one final question, and I call it the billion-dollar question, Professor Sridhar. When and how do you see the world putting coronavirus behind it? When will that moment come?
In the long term, I think there's really only three endings to this story. The first is we get a vaccine in the next 18 months. Getting the science done will be half the battle. The other battle will be actually manufacturing enough doses and getting it into people. So that would be a really positive ending, that actually we get a vaccine very soon. The second is we get a therapeutic of some kind that makes it a mild illness. And so this becomes a regular, seasonal, endemic infection, but one that's not seen as being deadly because we can treat it. A third route is actually we see that we don't develop a treatment or a vaccine, and this virus looks particularly dangerous. We might see something called immune enhancement, which is if you're re-exposed to the virus, your body reacts badly to it. In this case, we might actually see countries come together and try to attempt some kind of elimination, try to work together to actually drive this virus out. This would only be, I think, kind of a last resort solution. And the final one, which is probably the saddest, is that the virus is just let go. At some point, countries realize they can't stay in lockdown forever. They can't build the necessary capacity to deal with it. And then we just have what we had in 1918, which is the virus runs through, whoever survives, survives, whoever doesn't. And we learn from this, grieve from it, and try to prepare for the next one.
Well, Professor Sridhar, obviously, therefore, you're sort of pointing us towards a world where perhaps we still are uncertain about what lies ahead with the coronavirus. But you've given us a sense of the rules of the game when it comes to exiting a lockdown. And I thought the big takeaway was different strokes for different countries. One size doesn't fit all. Thank you very much, Professor Sridhar of the University of Edinburgh, one of the world's leading global health specialists, for joining me here today on Info Corona. That's it on the show, where we bring you news without the noise. The news continues here on India Today. Thanks for watching.
The all-new India